Thank you very much, Hassan. So, uh, please, if you can confirm, Hassan, can you see my screen?
Yes, yes, I can.
Okay, great. So, our presentation and our project is totally different than what other participants present. Our one was a need-based project. So our main was a predictive modeling technique to estimate the burden of acute malnutrition and severity mapping in the absence of recent anthropometric data. So this was basically our main title. Now, why sorry, can't see this one. Why was the project needed? So basically, you know that when we're talking about nutrition cluster, so usually on yearly basis we are doing our HNO, humanitarian needs overview, and humanitarian response plan. And HNO we are also calculating our PIN, people in need, and we are also doing severity mapping for our priority. In South Sudan, we are lucky. We have a luxury that we are collecting our anthropometric data like twice a year. But unfortunately, because of COVID-19, this time those our anthropometric data was suspended, and we didn't collect in the recent round of FSNMS. So FSNMS is basically our food security and nutrition monitoring system, which usually we are collecting twice a year data on this. So now the question was for us for a cluster when we were doing our severity mapping, when we were doing our HNO needs, needs where when we were doing our PIN for nutrition. Usually we are following some, we call it like some uh, 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 we can say that formula we are using for that one, where we say that global acute malnutrition multiplied by uh, with population, and we apply incidence and correction factors, and we come up with the with our pin calculation. Now, because of COVID-19, we were not able to collect anthropometric data, and there was no game. So that was the main reason behind this, that why we did this data modeling. No, basically, so uh, what was the purpose? I think I mentioned that this one already. So the main purpose was to estimate or proxy game or proxy SAM or on the base of our historical data. So what kind of data available with us? So for us, we have like this is SNMS. The current round was round 26. So we are collecting information from round 21st, but unfortunately, the information which we collected in round 26 was not prior to 23rd rounds was not existing there. So was only available on the round 25th, 24th, and 23rd. So for our training data, we use FSNMS round 23rd, 24th, and 25th, and we use the common indicators from health, wash, FSL, nutrition, likelihood, and shocks from FSNMS, all these FSNMS rounds. There were almost like 30,000 observation was in our data set. Be very honest, the initial data set was not that much clean, so we clean it. We proper clean it. We remove smart flag, WHO flag. We also try different data wrangling. So we actually prepare our data set for training. And then we use for predictor, we use around 20, if it's name is around 26, and we did the same thing. We did our data cleaning there. Now, methodology, the one we use it. So the first thing, we use the historical data from round 23rd, 24th, 25th. We develop our we use our different predictive algorithms, like we use random forest, support vector machine, logistic regression, codec data analysis. We use LDA, and then we develop our predictive model on that. And basically how the model is working, so I already put in the corner, like basically we use historical data, then we use predictive algorithm, and we develop our model, and then this model we apply on new data, and then you will be able to see your prediction. So the same thing we did here. We use historical data, we built our model, and then we uh, we we test that model on new data set, and then we able to predict the nutritional status. And then we also at the end we aggregate our data to county level. So for us in South Sudan, county is our admin level 2, like state, and then we have county. uh, Model and key outcomes. Right, so our main outcome was to predict game and same rate. So our data set was individual information. So we were basically predicting the game rate 1 and 0. So we were predicting this one, and the model, the one we tested. So we tested logistic regression, we random forest, SVM, linear discriminant analysis, quadratic discriminant analysis. So we try all these model. And for feature selection, I think this was for us was a bit like uphill task. So in our data set, we had almost like more than 130 variables were there. So for feature selection, we applied different techniques. So the first one we use like high collinearity. We removed those variables, and then we did backward and forward stepwise selection. And it then again there was a big number there, variable was still high. Then we apply it then last regression to further select our features. We also try another technique called Baruta, but that was not didn't work for us. I also want to mention here that when we were doing our when we were developing our data model, our data was the data set was like imbalanced data set. So we apply our sampling techniques there. These are different techniques usually we are using. So we use that one, and then we compare all these, the output of all these variable on the base of accuracy, sensitivity, and specificity, and then the best performance we selected. The result which we got from our model, uh, we also did a gut check on that. That what we got from the model, is it makes sense or not? So we involve different technical people on this to overview and look to all data, uh, and uh, and the area where we are thinking that the result of this model is not making sense. We if we use a technique called hard disk imputation technique, where we replace the game rate of that one with to look to the previous rounds, from rounds 25th, 24th, and other smart survey if available, and we say that okay, let's let's use this game rate, and we really took like expert opinion there, and which was very important. So this was basically the result of our different algorithms. So logistic regression, random forest, support vector machine, linear discriminant analysis, and quadratic discriminant analysis. If you look, so random forests were doing quite better than other models, and that's why we selected random forest. So this was the result of our this is only for, like you can see now, only for a few counties. So this was basically our predicted game proxy game rate. This game rate was from the previous rounds. So we also look this one, that how it changed. We also look to the previous rounds as well, and we did a triangulation with the smart surveys and other key features which was available. We were also cross-checking the game rate. For example, when we realized that okay, the model is predicting here the game rate is very high or very low, what is the reason? So we also look to other things, like we look to flood area, communal fighting in the areas, And to all those factors, we also consider that we want to further validate our game rate. So like this, we did not just like agree on this game rate, but we also validate that one with our technical people. I also want to mention here in our technical people, we had people from UNICEF, Reach was there, and WFP. We have Global Cluster was also involved there. So we went to each county and we really compare all those factors which was existing there. Strength of machine learning. We know that the machine learning can help understand complex non-linear relationship. Cause malnutrition is much better, especially particular if you use like random forest and neural network is doing quite better work. And then wide variety of multi-sector household and individual level indicator available for exploration. For us in South Sudan, we have a lot of these variables. This was the strength for us that we have all those variable, all those data was available with us, and then we use that one. And they large sample size from historical FSNMS data. So we had almost like 30,000. The one which we cleaned the data was 30,000 individual information was there. And then I must say that this was a very important point that the impartial method for proxy game estimate compared to group consensus method is much better. Like when we agree on with consensus, and if when we use machine learning will always if you have indicator, if you have historical data, it's much better than when we are discussing on the group when we are building our group consensus on the game rate and same rate. Weaknesses. So this one is not like other projects, the one was presented today by our participants. This was for us like almost 10 days work. So team was limited in terms of time and workload. And so for the same time, like we were also working on FSNMS, IPC was going on there, HNO and HRP business was there. So really the time was and limit was there. Then the feature selection, the one we selected, we use like these three techniques, but we still think that we can refine this and we can work on this and we can refine this one. In the area where we know that if you have poor quality data, the prediction will be also poor. So we know that this is also one weakness of this model. And then comparing result at county level, usually in FSNMS when we are using that, we say that sometime the representative is in FSNMS is not adequate, and we usually recommend that to use domain result for historical comparison. So we can do that. Currently we use this one for county level, but for domain level we can also use that. Okay, potential application. So imputation of child nutritional status. When you have poor quality anthropometric data, you can use this is a potential there that we can use this model. And I strongly believe, like in South Sudan context, if we continue to collect information in other FSNMS rounds, the same information, a time will come that this model will give you very near result to smart surveys, because usually the beauty of machine learning or artificial intelligence, that is learning with passage of time. So we will have, if we have a good data set in future, it will give us quite good result. And then prediction of malnutrition through remote household survey. For example, like currently in this case, uh, when we were in COVID-19, we were really facing challenges to collect information. So if we built a model and those predictors, if we collect those information on other modalities like through MWAM or by mobile call and collect those indicators and then use those indicators. So it will also help us in our prediction of malnutrition. And then we know that sometimes it's difficult to explain artificial intelligence. So we will further advance in explainable artificial intelligence, this one. And then identification of cost pathway for malnutrition reflected with the complex modeling. Next step, we when we were doing this one, the clean data set was not available. Now for us, we got the clean data set, so likely we will run this model again on the clean data set, and hopefully it will give us much better result on this one. Then exploring additional methods like today XGBoost, we heard from Elisa, one of our colleague, she was presenting this one. So we say to random forest to improve performance, we can use some other models like this one. We can also use neural network. We did not yet try it. We can use that one. And then yeah, is already in the third point is exploring performance and neural network model. And for variable selection, we can also use principal component analysis, PCA. We can also use that one. We are thinking to use that one. And we were also thinking, because we already have now a result from uh, our model, uh, if we can like, and we are actually trying this in one area now, smart surveys, smart surveys are doing that. So if we can also validate the model result with a smart survey, so this will be also very helpful for us. So this one we are doing, and hopefully we will come up with a better thing. And one I think one of our colleague mentioned the publication. We are also thinking to do our publication on this one, is also a next step. So thank you very much, Hassan. Over to you for Q and answer. And sorry, before Hassan, Saeed, if you anything you want to add here, anything if you want to add.
Thanks, Kutab. I think you covered it quite clearly and succinctly. I don't have much to add other than I think the results of this were quite interesting and good. And I think there is room for us, as Kutab mentioned, we were quite stressed on time during the HNO, during the IPC last year working on this. There's certainly room for us to improve some of these preliminary results. And we think we can still improve the performance of the models that we showed here today, such as the random forest on the previous slide. But no, I have nothing else to add other than that. So thanks, Kutab.
Thank you. So over to you, Hassan. For
Great, thank you very much, Kutab. And yeah, so we have a question from Mara, and she's asking, out of all the variables collected in the FSNMS, could you see which ones were more important to predict acute malnutrition?
yes, so Mara, thank you very much for this question. So initially, when we were looking to variables, there was like 132 variables, or I think more than 132 variables. We run all these techniques for feature selection. At the end, we only shortlisted 42 variables, and we can share that one with you, Mara. I think is a list there for 42 variables, so we can share that one. And we are still thinking that we can further shortlist more indicators there, and that is also one of our next step.
Can I add in?
Yes, please, Said.
So with the random forest models, it is possible to pull out like the top 10 or 15 most important variables and such. So we are able to see those and share those results. But again, one issue with some of these machine learning methods are just how black box they can be, which is why we had that comment in the last slide about explainable artificial intelligence, which I'm not as much of an expert in, but it's something that's still being developed in the last couple of years and still moving forward. And there are methods in that are being developed that could help pull out more interpretable results from these kind of models that we're working with. Yeah, sorry, thank you.
Okay, so we will share, Mara, all those results, like which one is the most important from first to 42. We'll share all the list with you.
Great. Do you have any other questions for Kutab? Okay, maybe Kutab, you can tell us a little bit about the, what was the impact of COVID and lack of data to the exercise that you did on this modeling?
Yeah, so Hassan, it's very good question. So usually for previous years, we used to have we used to conduct smart surveys, and for us was very easy, like all our global acute malnutrition rate, our severely acute malnutrition rate, same rate was available. Same for even for FSNMS round. So we used to have like all those game and same rate. For this year was a big challenge for us like there was no recent anthropometric data, and to do our severity mapping, especially for OCHA, the one we are doing. We were, and then for prioritize areas. So we were really facing a big challenge, and this was for data. And then the second thing we also noticed, because and this time our IPC workshop was also because last years we were sit in one room, we were discussing. This time all things were online, was on Zoom. Was also a lot of challenges there, because in many areas, many of our partners, they have internet issues. In many counties there was internet issues. And then even the data, the one we received, we also received a bit late this year. So these were different challenges, and basically because of COVID, we were facing all those challenges.
Great, thank you very much. I don't know if we have any other questions, but if we don't, then we are now at the end of our workshop for the day. I'm going to invite Anna to help us wrap up and close the workshop. Anna, over to you.
Thank you, Hassan. Let me just open my screen with the first day. So thank you very much to all of you for being so much on time and saving even 15 minutes of the time, which gives me half an hour for the closing remarks, which I'm not going to use. So let's go very quickly through what we did today. So we started with the IPC acute malnutrition forecasting to see how currently we are doing forecasting. We looked at the geospatial data solutions that can help us in collecting the data which we all need in order to predict information, especially if we do it not at the country level where they do have access to their data, but more at the global level. We looked at all the different possible artificial intelligence related projects which are currently done by IPC Secretariat. They are focusing on the food security, while there is still also a potential to involve acute malnutrition. Well, then we looked at the hunger map and how they predict insufficient food consumption. And also undernutrition and what is the link with malnutrition. And then we looked at the two presentations which specifically look at forecasting acute malnutrition, which is slightly different approach. One is more for the research purposes, which seems to be quite successfully predicting acute malnutrition at several countries, and South Sudan, who actually looked at it from the immediate implementation point of view. I hope you all have quite a good understanding now of this project. We still have a couple of more for our second day. So stay tuned, please don't miss the second day. What I got from the first day is that there is quite a similar thinking among all people involved in this project. There is an understanding that we do need to have acute malnutrition prediction. And there is already quite a lot of work done into defining what other indicators from other sectors can be used as a prediction for the acute malnutrition, which I think for any other project that will, or if it will be starting, that's already a great start to explore this further and to develop the methodology further. So without further ado, and if you don't have any other questions, I'm happy to close this workshop half an hour before we planned. And I'm looking forward to seeing all of you on the 3rd of March for the discussion. And I please do take this time to think about how best is to move forward, taking into account that we want to look into more global perspective and how we can support all countries with prediction of nutrition outcomes. Thank you all.
Thank you everybody, and see you.
Thank
on
you,
the
everyone.
3rd of March.
Bye.
Thanks, everyone. See you next week.
See you. Bye.
Thank you.